My name is Taylor and I'm a dental hygienist here at Advanced Family Smiles in Northeast Philadelphia. Today we're going to talk about periodontal disease, what it is, and how you can treat it and how you can prevent it. So periodontal disease is gum disease in layman's terms, but it's mixed with bone loss. So when you come in, we do a full set of x-rays, we do periodontal charting. Then we're able to show you where the bone level should be on your teeth and where it is in the case of periodontal disease. When we do perio charting, we want it to be 1 to 3 millimeters all throughout the mouth. In periodontal disease, we likely see 5, 6, 7, and up. This means that the pocket around the tooth is larger because we have bone loss, because we have inflammation, a mixture of the two. Ways that we treat periodontal disease in our office is with scaling and root planing. So we explain this all to you after we diagnose that you need scaling and root planing. And what this is you come into the office, we do one side of the face at a time. So we'll come in, we'll do the right side. We get you numb on the top and the bottom. We make sure that you're super comfortable, and we go in, we go under the gums, we manually remove all of this bacteria, tartar that's been growing under the gums. When all of this is under the gums, this causes the bone to recede because all of this contains bacteria. When it gets close to where the bone is, the bone doesn't want to be next to it, so it starts to recede, and that's when we see bone loss. The problem with periodontal disease is that the gums and the bone are what stabilizes the teeth in the mouth. So it's basically the foundation for your whole mouth. It likely is the most important part of your mouth. So when we see advanced periodontal disease is when we start to see patients losing teeth, patients with mobile teeth, patients that are toothless. Ways that we can prevent this at home and in the office is making sure that you keep on regular visits with your dental professional. A lot of times patients will come in and they'll say, I haven't been to the dentist in 5, 10 years. That's when we see all of this has built up under the gums because patients aren't able to remove all of this at home, and it starts to build up, and that's when we start to lose bone. We see a lot of gum inflammation. We want to keep regular dental visits. We want to make sure that we're doing a proper cleaning at home as well. So brushing, preferably with an electric toothbrush, 2 minutes twice a day. Making sure you're getting all areas of your mouth, angling it towards the gum line, not missing the gum line because that's likely where a lot is building up because it creates a ledge off the tooth. Making sure we're flossing. You have to floss under the gums. A lot of patients will say, oh, I don't floss under the gums because it makes me bleed or I have gingivitis, but it's actually the other way around. You have gingivitis, you are bleeding because you're not flossing under the gums. So all that bacteria is staying in there, and that's what's causing all this inflammation. We have to make sure that we go under the gums. It will bleed until it starts to get healthy, and then you'll see where it's not bleeding. All in all, basically, we want to treat periodontal disease. We will not get the bone back that has been lost, but we can stabilize the gums and help it to not keep progressing so that we can keep all of the teeth that the patients have in their mouth. Because ultimately what we want to do is preserve anything that we have in the mouth. We never want to remove teeth if we don't have to.